So in this video, I'm going to show you two things: how to give a horse a shot or medicine intramuscular in the muscle, and how to give a horse medication orally. So first we're going to go to intramuscular, which this is just one of the sites where you can give a horse a medication in the muscle. You want to make sure that you're within this triangle. So here's the scapula, the horse's shoulder, the nuchal ligament here down the neck, and then their spine is here. So you want to stay right in this muscle. You can do it in their hind end as well, which you have a broader space, but this space here tends to not make the horse as sore. So things that you need: gloves. You want to make sure the horse is clean. And ideally, you would not want the horse to be on cross ties. You'd want the horse to be on a lead line and somebody holding the horse just in case the horse has a reaction. So I know this horse, he's had shots before and he's okay with it. So I'm confident that he will be fine with standing here on the cross ties, but it is not considered the safest option. Okay, so first we're going to clean the area with an alcohol swab. And I made this triangle here for you so you can visually see where the medication should be administered. And today what I have is Adequan, which is a joint supplement that I give him a few times a year in order to help him stay strong in his joints. Okay, so when you have this, you want to make sure there's no bubbles. You want to check to make sure that it's the right dosage. So he should have, there you go, 5 cc's. Okay, next, you want to make sure the horse is okay and calm and not going to move, not going to go anywhere. I already have my area cleaned. Sometimes we may pat the horse and then inject it so that the horse is more prepared for it and it's not a big surprise. You don't want to just come up and put it in the horse. Next, you want to make sure that you're not pulling any blood. So you should feel a little bit of resistance. Ooh. And you can go nice and slow. Now it's possible that some of it might leak a little bit. And that's okay, that's normal. The horse might have a little bit of a bump here. And again, that's normal. With Adequan, there's no real side effects with it. It's pretty safe, but you want to make sure that there's no infection from the needle being injected. Okay, so next we're going to do oral medication. And again, you should have somebody holding the horse rather than the horse on cross ties. And this is Banamine, which I'm going to pretend to give him a dose since he doesn't need it. I have it set where it would be a typical dose for a horse, 1,000 pounds. And the first thing that I would do is make sure the horse is okay with their mouth being touched. Okay. So his lips are a little pursed. He's not 100% comfortable with me touching his mouth. Horses don't typically like oral medication, so we want to go nice and slow with it. Ooh. Good And then before administering the medication, you want to rub the horse's tongue to make sure they don't have anything in their mouth. You want to make sure that the horse doesn't chew or bite on the plastic because they might crack it. So I'm just trying to make sure that there's nothing in his mouth. Sometimes they hide hay very, very far up their mouth. And then after you give them the medication, they might spit it out if there's hay globbed in there. So you could put it under the tongue, but with Banamine, it's best to put it on the inside of their cheek. And then make sure that the paste really sticks in there. Next, you want to hold the horse's head up a little bit and make sure they don't just spit it right out. Because some horses, they will do everything in their power to try to spit out the medication, similar to a child. Good boy. So the lips are still a little pursed. I'd like for him, good, to lick and chew. Now, if he really had the medication, then he might have some white paste around his lips, and that's okay. That's perfectly fine. You just want to make sure the horse doesn't spit out large globs of it. If I was giving the horse Oragel, which is a sedative, I would put it under the tongue, not on the cheek, because you want it to slowly dissolve. The good thing about Banamine and pastes like this is that it really sticks to the inside of the horse's cheek, and then that way the horse can really swallow it and get the full dosage. Thank you, Scout.